to discuss about mental health in this topic, how the mental health really is really important, and how as a mental health professional, clinician can help people. So moreover, we're going to talk about a lot of things. Okay, we're going to talk about how the mental health professional or the mental therapy works in the real world. So no so the most important thing, first of all, we should understand, like in the physical part, we know, okay, this part is damaged or this part is damaged. So, okay, your bone is damaged or your muscle is damaged. Okay, this is the injured part. This needs a treatment. So, how you really understand what is mental health? First, you should know which part is really affected in the mental health. So, unless you know that which part is affected, who's going to get a treatment for it? Okay. So just like in a physical perspective, there are certain things which get affected. Even from the mental health perspective, there are things which get affected. Okay, what can be the affected areas? Normally it is like the cognitive areas. Okay, so what do we actually understand by cognitive? There are various sub variables in cognition. Okay, cognition, we even call it a mind. Okay, and mind is a very complex thing in itself, and there are various variables to it. Okay, there are various sub components, sub parts in it which can get affected. So in the mind, we involve a lot of thought processes. Okay, there is a process for the personality, there is a process for the confidence, there is a process for the uh, lot of no there's a process going for the confidence, there's a process for your working capacity. Okay, there's a process going on how you interact with your family people, how you interact with the society. There's a process going for the phobia. So it's all in the brain. Okay, and that cognition, that cognitive errors, can be linked with the environmental factors. They can be linked with certain environmental stimuli. Okay, they can be linked with any certain behavior stimuli. So these are like could be linked up, but the problem is all in the cognition. So the cognitive is the area where the mental health professionals really work it. Okay, but it do have its extension in the environment and its behavior. So this is the thing we actually treated, and this is a really important part to be healed up, because once one who is suffering with the cognitive problems, or you can say somebody is going through a mental health problem, his all other parameters also get affected. And it is even seen that the people with mental health problems, their life expectancy is also reduced. So it is equally important to take care of your mental health along with your physical health. So I'm going to tell about how we as a mental health professionals really work. And right, so taking an example, okay, somebody is having an anxiety. What actually is an anxiety is, is a situational fear. Okay, when one gets gets all its feeling of panic and fear when a particular stimuli is presented before the person. So that is a situational problem. Okay, so but the causes for this lies in the cognition. Okay, so we try to identify that cognition error. What are the processes going in your mind responsible for particular anxiety? What belief system you have come up? So we have to evaluate your history. Your history will tell us like which how you have come up, and where you had a problem in the past, and what learnings you have come up with, and what learning are giving are responsible for this, for contributing to the anxiety. So there is a requirement for the detailed evaluation of the history, so that we do it. So that is a really important part to conduct in a psychological evaluation. So there can be a certain misbelief, there can be certain prejudices, there can be errors in your behavior pattern also. So these are all the things which needs to be assessed and need to work on. So there are a lot of things, when we assess a patient, and if we really work on these parameters, we can really see a difference in a patient outcome. So this is how we as a mental health professional works. So I feel there is a really a need to for people to make aware of how the mental health really works, is because I feel a lot of people are not aware of how the mental health works, and how how one can take a benefit and advantage of the mental health service. Okay, so I'm ending this video right now here, and I'll be coming up with new extra knowledges in my next video. Thank you.